What do people with dementia die of? Over the last 30 years as a registered nurse, this is a question I hear a lot. And I think there are three things that I usually see people die of after seeing hundreds of people with dementia. And let's jump in with number one, but make sure you stay around for number three because that's the one that I see most often with dementia patients. So number one is a fall. And you might wonder, why would a fall be the cause of death? But did you know that it is actually the number one cause of accidental death in people over age 65. So unlike when we're young and we fall and we bounce back up, in older people, a fall can be deadly because it can lead to a broken hip, it can lead to broken ribs, and that can then lead to a pneumonia or another problem. And so falls are a big problem. And in dementia patients, falls become an issue because as the dementia is increasing, we tend to see that they lose the ability to walk very well, even if their muscles remain strong. And in a normal person, they would still be walking. With the dementia, they forget the coordination. They forget how to put it all together. And so that leads to walking problems. And you couple that with the memory problem. What happens is that they can't remember that they don't walk as well. And you can remind them of that every day, but they still won't remember that they can't walk. And so what happens is they'll get up and they'll try to walk, and then they'll have that fall. Or they'll get up and they'll forget to use the walker. Maybe they would have been safe had they just used their walker, but they forget to use it. They forget where it's at. And so falls are definitely a problem that you have to look out for. And if you want to try to prevent falls with memory patients, you can check out my other videos. I have one that talks about some of the ways that I, in my care home, try to prevent falls. But as a caregiver, remember that you can't prevent everything, and a fall might just be what leads to death. But what is number two? Number two is an infection. And in the olden days, before we had antibiotics, an infection was actually considered to be old man's best friend because an infection leads to death in a way that's not usually overly painful. Usually the infection, as it gets to taking over in your body, which is called sepsis, you'll just get more and more tired, and you'll not be feeling like eating. You'll just sleep more and more, and you might have a fever. You might have some symptoms that aren't real comfortable, but if you call in hospice, those symptoms can usually be controlled really pretty easily. And so that is a lot of times what I tell people is that if you are to the point where you don't want to keep living with the dementia, letting an infection occur and letting that not be treated can be actually a very easy way to pass. And so what kind of infections do we see usually causing the death in dementia patients? That would be an aspiration pneumonia. And so this is a kind of pneumonia that happens because you've swallowed something into your lungs, and either food or water, liquids, and that creates an infection in your lungs. This happens with dementia patients because as the dementia is progressing, you find that they forget how to swallow well. And so they start having aspiration pneumonias as a result of the swallowing difficulties. We also, as we age, get where we don't swallow as well. And so you've got it increased with the dementia, and then you've got the memory problem. You know, with a person that's older who doesn't have dementia, they can learn to make sure that they tip their head down when they're swallowing, but a dementia patient can't remember that. And so that's how the aspiration pneumonias happen. And then a UTI, a urinary tract infection, is another common infection with older adults. And with the dementia patient, it can become widespread infection pretty easily because oftentimes we won't know that they have symptoms. The fact that they have burning or pain when they're urinating doesn't get reported because they forget about it once they stand up from the toilet. So unless you observe them having the symptom of the pain with urination, you might not ever know that they have it until they get very drowsy and start to just sleep a lot, which then can lead to the death because it can go up into the kidneys. So of course, infections, if they're treated early enough, can be treated with an antibiotic and a lot of times can be cured, but uh, sometimes people choose not to have the antibiotic, and sometimes it's just that we don't see the symptoms soon enough. So if you are a caregiver for somebody with dementia and you want some more tips on how to be a great caregiver, make sure you comment tips down below in the comments, and I'll send you my free guide to easy caregiving that I've developed after owning a care home and being a registered nurse for 30 years. But number 3 is what I predict is the most often the cause of death for somebody with dementia who doesn't have some other health condition going on. You have to remember that a lot of times dementia doesn't stand alone. A lot of times people have other coexisting symptoms and problems, and those things might actually end up being the cause of death. And that could be anything from diabetes to heart disease to a lung problem, any of the normal causes of problems in aging. But number 3 for dementia is actually just a slow deterioration in abilities. And so oftentimes what I see with a dementia patient is a stair-step effect where they will go along and they'll be pretty stable. And then all of a sudden you'll see a decline. And that decline could be from a fall or from an infection or just from a decreased ability to remember things. And then what will happen is usually they'll go back up just a little bit if you can treat whatever the cause of it was, and then they'll level off and have another plateau. And then they'll have another dip from something happening, and then they'll level off again, and they'll continue this stair-stepping down. Now, what happens during those stair-steppings is a loss of abilities. And so with dementia, what happens over time is that they get where they can't feed themselves or they can't remember to eat. And so even if you are being a great caregiver and feeding them all their food, they'll get where they close their mouth and they'll purse their lips so tight you can't get them to open their mouth and take any food. And then also what will happen is if you do put their food in, they'll spit it out. A lady with me has late stage dementia right now, and I was feeding her mashed potatoes with hamburger in it, ground meat, and it was all in small bites with a sauce. So I thought this is the perfect thing for her to eat. It'll get her some protein. And I gave her a bite and she spit out every little bit of the beef, of that ground beef. And that's the important part of her meal for the protein. And so there are other things that you can do to help with that problem, but she just couldn't understand that that was food. She was sure that it was something that wasn't edible and was spitting it out. And that will happen even with their favorite foods. But a lot of times to keep getting some nutrition, what I'll do is switch to a lot of sweet food because that is usually what they love. And you can actually live a long time on chocolate cake or ice cream. I really like to give people yogurts and ice creams when they're in later stage dementia because it just seems to go down easier and doesn't require chewing, which their coordination with chewing becomes an issue and their swallowing. And so that's usually what will happen with that deterioration is that they will get where they just don't feel the hunger. They don't recognize what it is, which seems crazy to those of us who still are hungry, right? We think that everyone would be hungry and that they would be uncomfortable from this lack of food, but they truly aren't. I have taken care of so many people over the years, and never have I seen them distressed by the lack of food or the lack of fluids. And usually what happens is food goes away first. And what I will often see is that they'll eat their normal amount at this plateau, then they'll dip down and they'll decrease their food intake by, a quarter. And then the next dip down, the food will decrease even more. And so it just slowly decreases over time and their bodies accommodate and get used to that. God made our body so wonderfully in that we can slowly, if we don't interfere with the process, our bodies will just slowly shut down. And it really leads to a very peaceful and comfortable death. And so I oftentimes will hear from people, well, I'll just start a feeding tube for my loved one, or I'll start IV fluids. And I really try to discourage the people that I am helping from having that happen because it's interfering with the actual normal process. And we like to think that we can avoid death, but in reality, we all are going to pass away of something. And so in interfering and giving a tube feeding, what oftentimes will happen with those tube feeds that people don't realize is that you'll get an aspiration pneumonia from it because it will come back up and end up in their lungs. And so then you're dying of a pneumonia instead of just passing smoothly and quietly from lack of eating and drinking. And people can go a long ways on that reduced intake. So just because you see your loved one take a dip doesn't mean that tomorrow is going to be the day that they're going to pass. But it might be the time to go ahead and call hospice and have them evaluate and see, is your loved one ready to go on to hospice? The other thing to remember is that usually by the time the food and the drink is decreasing to the point where they're going to die of that, they're usually not very communicative anymore. They usually are not recognizing people. They're usually not walking. And so all of those things have slowly decreased over time to the point where now all they're going to do is just sleep. And that truly is in the end what the dementia patients who go through the natural process, who don't have a fall or don't have an infection, they just get where they sleep more and more hours of the day, and to where maybe they only wake up when you're feeding them. And so eventually they just don't wake up at all. And I encourage you, if you are a caregiver, to get help. Have somebody come in and evaluate so that you can understand where your loved one is in that process. And if you want more information about caregiving, make sure you check out my videos, and I will see you in the next video.